the channel Dewdear Academy. In this video, I have included the question paper discussion of the staff nurse examination conducted by Sree Chitra Institute for Medical Science and Technology, Trivandrum, in the year 2019. So, I will be discussing these questions. First 15 questions I am discussing in this video. And now I will start the question. First one, a patient has undergone surgery for pituitary adenoma through transsphenoidal approach. The nurse understands that it is highly significant to specifically monitor. So this is a question from neurology, nervous system, disease conditions associated with the nervous system. So the question is, if the patient has undergone surgery for pituitary adenoma through transsphenoidal approach, the nurse understands that it is significant to monitor. Options are hemodynamic status, vital signs, visual acuity and visual field, hearing acuity. So the important key point is the surgery is done for pituitary adenoma through transsphenoidal approach. So what is it important to monitor? The correct answer is visual acuity and visual field. Option C is the correct answer. It is important to monitor the visual acuity and visual field. Okay, so in this question, the correct answer is visual acuity and visual field. Then, second question, the brain abscess is more frequently diagnosed in people who are. Options are on anti-epileptic medications. Option B is immunosuppressed. Option C, in the third and fourth decade of life. Option D, having head injuries. So brain abscess is more frequently diagnosed in people who are. So here the correct answer is option B is the correct answer. That is immunocompromised patients. Brain abscess is more frequently diagnosed in people who are immunocompromised. Third question. Glycated hemoglobin HbA1c, it is a blood test that reflects average blood glucose level over a period of approximately. Options are 0 to 1 month, 1 to 2 month, 2 to 3 month, 3 to 4 month. Question is glycated hemoglobin. Glycated hemoglobin or glycosylated hemoglobin or HbA1c, which is indicating the average blood sugar over the past 90 days. So it is reflecting approximately the average blood glucose level over a period of approximately how many months? That is the question. So here the correct answer is option C is the correct answer, 2 to 3 months. Okay, HbA1c is reflecting the average blood glucose level over a period of approximately 2 to 3 months. Then question number 4, the site that has the highest rate of absorption for insulin is. The site that has the highest rate of absorption for insulin is. Options are abdomen, thigh, upper arm, scapula. Abdomen, thigh, upper arm, scapula. The correct answer is option A, abdomen. Correct answer is option A, abdomen. Abdomen has the highest rate of absorption for insulin. Then another question is, an accurate daily weight must be recorded for patients with kidney disease because of 1 kilogram weight gain is equal to retained fluid of. Options are 500 ml, 1000 ml, 1500 ml, 2000 ml. An accurate daily weight must be recorded for patients with kidney disease because 1 kilogram of weight gain is equal to how much of fluid retention it is indicating. So that is important that you should know 1 kg weight gain is indicating 1000 ml. 1 kg weight gain is indicating 1000 ml of fluid retention. 1000 ml. In case of patients with kidney disease, it is important to monitor the accurate daily weight. And if there is 1 kilogram weight gain, means that is indicating 1000 ml, or we can say 1 liter. 1 kilogram weight gain is indicating 1000 ml or 1 liter of fluid retention. Then question number 6. While administering caecsulate retention enema to promote the potassium removal, it should be retained for. Options are 10 to 15 minutes, 15 to 30 minutes, 30 to 45 minutes, 45 to 60 minutes. when administering this hyaxylate retention enema to promote the potassium removal, it should be retained for. So here the correct answer is option C is the correct answer. It should be retained for 30 to 45 minutes. It should be retained for 30 to 45 minutes. Then question number 7. After hyaxylate retention enema, a cleansing enema is usually given to. Options are to remove the remaining hyaxylate if any, prevent fecal impaction, prevent diarrhea, prevent electrolyte imbalances. So which is the correct answer? After administering this hyaxylate retention enema, a cleansing enema is given. So it is given to prevent the fecal impaction. It is given to prevent the fecal impaction. So option B is the right answer. Cleansing enema is given after administering this hyaxylate retention enema in order to prevent the fecal impaction. Actually, that it helps to remove the remaining hyaxylate and it helps in preventing the fecal impaction. So the correct answer, most appropriate answer here is preventing fecal impaction. Then question number 8. The reason for more than 90% of recurrent urinary tract infection in women is. The reason for more than 90% of recurrent urinary tract infection. That is the point that we have to note. It is recurrent urinary tract infection. So what is the reason for it? Options are reinfection with new bacteria, then structural abnormalities in the urinary tract, then persistence of the same organism, renal stones. So here the correct answer is option A. That is, it is indicating the reinfection with new bacteria. Option A is the correct answer. It is indicating reinfection with new bacteria. Okay. It is not indicating the persistence of the same organism, but if there is a reinfection with new strains of the bacteria or new bacteria, then that is considered as a recurrent urinary tract infection. Then question number 9. The criterion that indicates malfunctioning of a pacemaker is. Options are short T waves, normal sinus rhythm, no spikes appearing on ECG, pairing spikes followed by wide QRS complex. Pacing spikes followed by a wide QRS complex. So what is the criterion that indicates malfunctioning of a pacemaker? So if there is no spikes appearing on ECG, that is indicating malfunctioning of the pacemaker. Okay, if there is no spikes appearing on ECG, that is indicating malfunctioning of pacemaker. A patient receiving intravenous aminophylline should be monitored for. Options are hypotension, then visual disturbances, decreased pulse rate, decreased urinary output. So aminophylline, it is a bronchodilator drug. Aminophylline, it is a bronchodilator drug, mainly coming in the category of xanthin derivatives. Theophylline, aminophylline, these are all xanthin derivatives. So, patient receiving IV aminophylline should be monitored for hypotension. Option A is the correct answer. Hypotension. If the patient receiving aminophylline intravenously, he should be monitored for hypotension. Then the next question. The amount of sodium in 1 gram of salt is. How much is the amount of sodium in 1 gram of salt? Options are 293 milligram, 393 milligram, 493 milligram, 593 milligram. How much is the amount of sodium in 1 gram of salt? So the correct answer is 393 milligram. 393 milligram is the amount of sodium present in 1 gram of salt. So this is a general question also that you should be aware of this question. Then the 12th question, the nurse providing care to a patient with water seal drainage observes fluctuations in the water seal chamber. So what does this indicate? Options are an air leakage in the drainage system, obstruction of the tubing, then suction applied is more than required, the system is functioning properly. So from this it is clear these all questions are mainly concerned with the nursing procedures, water seal drainage, NG tube feeding. So this you should also study the important nursing procedures and the nursing implications and nursing care aspects associated with these nursing procedures. So questions can be asked from these areas. So the water seal drainage is an important area that you should get prepared when preparing for the exam. So what is indicating if there is fluctuations in the water seal chamber? Options are air leakage in the drainage system, suction applied is more than required, obstruction, the system is functioning properly. So answer is, if there is fluctuations or tidling, it is indicating the system is functioning properly. The fluctuations, it is also known as fluctuations in the water seal drainage, it is also known as tidling. So that is normal. So that indicates the system is functioning properly. Then question number 13. Lactulose is given to patients with hepatic encephalopathy because it options controls bleeding from esophageal varices, reduces ascites, prevent uremia, reduces blood ammonia concentration. What is the purpose of administering lactulose to patients with hepatic encephalopathy? It is given, the condition here mentioned is hepatic encephalopathy. And what is the purpose of administering lactulose? So here the answer is, it is given to reduce blood ammonia concentration. Okay, it is given to reduce the blood ammonia concentration. Then question number 14. That is, the main purpose of MELT score is to determine, MELT score. It is to determine the prognosis, type of treatment, organ allocation priorities, the type of cirrhosis of liver. What is the main purpose of MELD score? So first we should know this score is associated with what, or what is the full form of this MELD score. So MELD score is model for end stage liver disease. MELD score. MELD score is model for end stage liver disease. So that is important. You should know the question. If a score is given, you should know what it is. What is the full form of this score? So model for end stage liver disease. So here we are scoring the patients based on this is indicating what is the purpose of scoring this. MELD score is assigned for what? That is the question. So for the prognosis, to determine the prognosis, to determine the type of treatment, then to determine organ allocation priorities, then to determine the type of cirrhosis of liver. What is the answer? Answer is option C, that is organ allocation priorities. To determine the organ allocation priorities in case of patients with liver disease, we are giving this score. We are assigning this score for determining the organ allocation priority. Then the 15th question, pancuronium is administered to a patient on PEEP diagnosed as ARDS. Options are to reduce patient fighting with ventilator, to reduce the anxiety, to reduce the discomfort of the ventilation, to reduce hypotension. Pancuronium is administered to a patient on PEEP diagnosed as ARDS. So what is the purpose of administering this drug if the patient is on ventilator? That is the question. So here the answer is option A is the answer. That is, it is to reduce the patient fighting with ventilator. Pancuronium is administered in order to reduce the patient fighting with ventilator. So these are the 15 questions I have included from this question paper, SCT, Staff Nurse Examination question paper. So from this you can identify which are the areas that you should give priority to study. It's very important to study the cardiology, the neurology sections, and also it is important to know all the basic aspects in nursing, the basic nursing procedures and the nurse's responsibility. And also you can expect the questions from any sections, uh, even if you are giving priority to cardiology and neurology, it is clear that from different other systems in medical surgical nursing and also from other subjects in nursing, we should give the importance to learn. So thank you for watching this video.